Myself, Azruddin Gohil, a student of PP Savar University, studying in BSc Biotechnology of semester 6. Today, I am representing a seminar on RSV virus, respiratory syncytial virus. Discovery of respiratory syncytial virus. It was discovered by Morris and his colleagues in 1956 from a chimpanzees from URT, upper respiratory tract. Major cause of RSV. Human respiratory syncytial virus RSV was quickly determined to be the human origin and was shown to be the leading worldwide viral agent for serious respiratory tract disease. RSV viral structure. RSV was range in 150 to 300 nanometer. It contains G protein and F protein in it. Here is the structure of RSV virus. It has fusion, matrix, attachment, lipid membrane, RNP complex, etc. Here is the image of RSV virus, how it looks like in microscope. Differ from paramyxovirus. The size of nucleocapsid diameter is less than paramyxovirus. RS virus are placed in a separate genus, pneumovirus. RS virus do not withstand freezing. We cannot stand freeze the RS virus. Specimen for isolation should not be frozen. The virus is relatively fragile and may not survive in snap freezing at 700 degrees Celsius. Propagation of RSV. It can be propagated in HeLa and Hep2 cell culture line. Highly liable virus and prominently inactivated at room temperature. Serotyping of respiratory syncytial virus. In Newcastle, up to 9 strain of a subtype A have been prevented every year since 1974. RS virus not infected human but also infected animals. Both goats and sheep may be infected brutally or naturally. Even rodent can adopt it after some adaptation. It can infect cattle as well as the chimpanzees also. RSV majorly infected the children. RSV causes respiratory illness, infectants, and in young children, and is the most important cause of bronchiolitis. RSV is recognized as the most important cause of serious lower respiratory tract illness in infants and young children worldwide, causing a repeat infection throughout life with serious complications occurring in the elderly and immune compromising patient. Here, how RSV infect. Major areas of infection in RSV virus. Majorly, it infects nasopharynx, clinical features of RSV. The peak incidence is in those under 1 year of age. The most serious illness manifests with bronchiolitis in young babies. A person suffering from RSV virus infection may have symptoms like fever, cough, rales, wheezing, etc. RSV is life-threatening disease for those whose immune power is very low. The RS viral infection is potentially in those with or congenital heart disease, bronchopulmonary dysplasia defect, or in those who are immunosuppressed or immune deficient. SDIS, sudden infant death syndrome. RS virus has been recovered from some victims of the sudden infant death syndrome. Although it may have been contributed to the death, other factors also significant for this contribution. Active clinical manifestation. The majority of infected present with the clinical feature of bronchiolitis. In majority of cases, recovery is complete. In older children and adults, the virus causes minor illness. RS virus can infect all age group. There are upcoming reports to show illness with some fatalities in old people's home as well as the elderly living in the community. The underdiagnosis can be attributed lack of confirming virological diagnosis in the adult and elderly. How the RSV virus infect a person? Attending a child care center, old sibling in a preschool or school, exposure to environment pollutant, multiple birth sets, example triplets or greater, minimal breastfeeding. Other contribution factors for RSV infection: premature children, especially less than 35 weeks, age younger than 3 months at the time of infection, chronic lung disease, respiratory rate more than 70 per minute in a room air, toxic evidence at the time of presentation, oxygen less than 95% on room air, etc. Here it is an image in which immunofluorescence enzyme, immunoassay, and culture are used for RSV virus to show how the RSV viruses look like. Serology. Immunoassay of G and F protein may offer more reliable serological tests in adults where other options are limited. Molecular methods in RSV viral infection. The emerging molecular methods such as reverse transcription, polymerase chain reaction, either for a single virus or a multiplex to detect a panel of virus. Treatment. How RSV virus is treated, or how a person with RSV infection is treated. A supportive management with a tube feeding in the case of difficulty in suckling, use of oxygen if indicated. Ribavirin, a specific antiviral drug, proved effective when given in a small particle aerosol, although it is apparently not effective intravenous infusion. Indication of chemotherapy. The chemotherapy with the ribavirin is expensive and it recommended use in the confined to those babies who are at the risk of rampant RS virus because they have congenital heart or lung abnormalities. The use of hyperimmune RS virus immunoglobulin and humanized monoclonal antibodies have become available for treatment and the prevention of RS virus infection. In view of higher costs, they are warranted in select infant born with low birth weight or pre-existing bronchopulmonary dysplasia. Epidemics and seasonal variation. The RS virus produces infection all over the world. However, the sporadic cases occur throughout the year. In a temperature climate in both the northern and southern hemisphere, RS virus causes a substantial winter epidemic every year. Vaccine. A formalin inactivated crud whole virus vaccine was tried in 1960 but failed to produce immunity in the recipient. The difficulty in preparing safe vaccine for RSV lies with the young and immunological immature recipient. Thank you.